And welcome to my YouTube channel. I'll be taking you through to poultry diseases, and we'll start off. But before we start off, I want to ask you to subscribe and like this YouTube channel so that you can be getting more and more videos about avian diseases. So we are going to start off from these, and this is Newcastle disease. Newcastle disease is viral disease of poultry, and it has synonyms: avian pneumoencephalitis, pseudofowl plague, ranicate, avian distemper. It first occurred in 1926 in Java, Indonesia, Newcastle upon Tyne in England, in 1935 in Kenya, here on Mombasa Island. It's caused by Newcastle disease virus, which is an unsegmented negative strand RNA virus. It is enveloped helical symmetry with a maglutinin and neuraminidase spikes and envelope. So simply, this is the structure of the virus that causes Newcastle disease. Yeah, so its distribution is usually widely distributed worldwide. It has enormous variation in clinical manifestation. It could be DOEL, which is acute, the beaches, which is acute lethal. It occurs in all ages. We have the body form, which is the mesogenic, the less lethal. We have the Ichna form, immunoapparent infection. We have the asymptomatic, the lentogenic virus infection. The transmission of these virus can be transmitted by inhalation of or ingestion of fecal or oral route. So we have the fecal oral route of when we have avians which are kept in an intensive care in an intensive unit, and then those others are eating their feces through their oral route, so they get infected. So bird shits virus in both feces and respiratory secretions. Fomites contaminated with virus exudates. Water, feed, eggs, trays, feed and water equipment handlers, clothes, sick birds movement, aerosol vehicles, carrier birds, domestic dogs are carriers. So the incubation period of this virus is 2 to 15 days, depending on the virulence of the strain and the susceptibility of the population. In chicken infected with a velogenic isolate, an incubation period of 2 to 6 days is usually common. So what are the clinical signs? So the clinical signs vary with the pathogenicity of the isolate and the excuse me, and the species of bird. In chicken, lentogenic strains usually cause subclinical infection or mild respiratory disease with coughing, gasping, sneezing, and rales. The mesogenic strain can cause acute respiratory disease, neurologic signs in some chicken, but the mortality rate is usually very low. So the mesogenic, as we said earlier, is the less virulent one. So the velogenic strain cause severe, even to fatal to death. So it causes mortality, high mortalities of 60% to 90. So the clinical signs are usually highly variable, and most birds are lethargic and inappetent, with their feathers may be ruffled, which is general sign in sick bird. Conjunctivitis and edema, watery, greenish or white diarrhea, and then we have respiratory signs including cyanosis or swelling of the tissue of the head and neck, sneezing, coughing, rales. So cyanosis is the blue color of the comb usually, and the respiratory tract. So this is one of the differential diagnoses for avian influenza. Yeah. So neurologic signs include tremors, clonic spasms, paresis, or paralysis of the wings and or the legs. That is torticollis. We have the twisted of the neck, suckling, and tics. Drop in the egg production. So the production is usually reduced, and the eggs may be misshapen, abnormally colored, and rough or thin-shelled with a watery albumin. We have sudden death. Usually you find a large herd of chicken which are already dead, and you wonder what will be the problem. So birds that survive for weeks usually live, but may have permanent neurological damage. So you might find still surviving, but they have poor coordination. And And then, so postmortem, after death, and then you do postmortem, what you see is most of the birds infected with phylogenic strains, most of them die. So you find edema and swelling of the head, periorbital region, and the interstitial tissue of the neck. So we have edema, we have fluids accumulating, and then we have edema. We have congestion or hemorrhages in the caudal pharynx and the trachea mucosa, and the diaphoretic membrane sometimes occur in the oropharynx, trachea, or esophagus. So this is one of the signs that we usually see with Newcastle disease. We have the petechiation and small ecchymosis of the mucosa of the proventriculus. This is one of the mostly the pathognomonic sign of this disease. Hemorrhages, ulcers, edema, and necrosis of the cecal tonsils and lymphoid tissue of the intestinal wall, including the Peyer's patches. Peyer's patches is the lymphoid tissue which is in the chicken. This lesion is particularly suggestive of Newcastle disease. Thymic and basal hemorrhages in young birds, difficulty to see in older ones because the regression of the basal. The spleen enlarges, friable and dark red or mottled. Pancreatic necrosis and pulmonary edema seen in some birds. Ovaries become edematous or generated and may show hemorrhages. The birds die suddenly after with few or no signs. And then the diagnosis of this disease. This is usually very helpful for you to confirm that this disease is the one and not any other. This will help in stopping zoonosis actually, because when you confirm, you are able to handle the carcass of those that the carcass of those that died. So clinical signs, you might use the clinical signs. You can use the postmortem lesions, which some of them we've learned, we've seen them in the signs. We have the virus isolation, so we isolate the virus, and then we can do polymerase chain reaction. We can do enzyme-linked immunosorbent assay. We can do hemagglutination. We can do AGID, which is agar gel immunodivision. And then for prevention of this disease, we do biosecurity. Biosecurity is where we vaccinate animals, we control movements and sanitation into the avian housing, or we control by use of water baths and everything else. So control is usually whenever possible, workers should avoid contact with birds outside the farm, and then the biosecurity measures must be taken seriously so that we reduce on these disease. I'm sorry about that. I'm sorry about that. So so that's the control of this, and then all in and all breeding, all in and all out. The protocol should be followed to allow us to control this disease. So these are some of the pictures that shows us how Newcastle disease is very motile, is very dangerous actually. Yeah, so this is conjunctivitis. This is a picture showing us conjunctivitis and swollen sinuses. Yeah, we have so this is a graph showing us the higher percentage of so when there is increased percent of eggs, and then it reduces with weeks as the disease increases, or the virulence of the disease also increases. So we have this picture showing us twisted neck or torticollis. We have hemorrhages of the proventriculus, which is a pathognomonic sign. We have swollen and mottled spleen, so we can see the spleen is swollen, and then we have down here, when we can see some spots, which is mottling. So this is a histologic section of the trachea epithelial cells left, leaving raw areas and submucosal edema. We have non-purulent encephalitis. This is another picture of another histologic section of the avian brain. We have the perivascular curving in the brain. Yeah, so thank you very much. Please subscribe and keep watching for more videos. Next time we shall be doing infectious bronchitis. Thank you. Thank you very much.